Okay, welcome everyone to Demography Today lecture series, sponsored by the BBVA Foundation and co-organized in collaboration with the Spanish National Research Council, the LOMPOP Horizon 2020 project. And we have the pleasure today to have here Stephen Matthews, who is a liberal arts professor of sociology, anthropology, and demography. And for the past 5 years, he has been the director of the graduate program in demography at Penn State University in the US. Matthews was trained in quantitative geography and planning, and for 18 years served as director of the Geographic Information Analysis Core at Penn State National Institute of Child Health and Human Development, funded by the at the Population Research Institute. He has led the National Institute of Health-funded training initiatives in spatial thinking and methodologies applied to health and demographic research in the US, and was co-editor of a recent book, this one here, on recapturing space, new middle range theory in spatial demography. The central tenets of Matthews' teaching and research scholarship are population health and health inequality in community contexts. He has published in the leading journals in several fields: demography, sociology, geography, public health, and epidemiology, on topics including residential segregation and neighborhood change, activity-based research, physical activity, diet and obesity, food environments, alcohol outlets, adolescent risk-taking behaviors, access to health, women's health, mortality, border malaria, social spatial networks, crime, and religious landscapes. Matthews was an associate editor for Demographic Research, one of the leading journals in the world in demography, and has recently served on the editorial boards of 4 other journals: American Journal of Preventive Medicine, Spatial Demography, and GeoJournal, and he has been at the editorial board of Demography, and from 2016 he is the co-editor of Demography, that is the leading journal in the world on demography. So for us, it's a great pleasure to have you here in our lecture series. As usual, we have between 45 minutes to 1 hour lecture, and then we will open the floor. So welcome.
I submitted an abstract that went with this talk that promised a lot, and hopefully if I get to cover half of the material that's promised in that abstract, you'll be happy and feel positive about what I'm going to say. My own goal is that I want to help you think differently about demography, and specifically about how spatial thinking in demography how spatial thinking can inform demographic research. There's several themes I'm going to try to get across during the talk, and specifically it's going to focus a lot on issues about fundamental spatial concepts, and in theory also interlinked with all of this is going to be a focus on training and the need for training in spatial thinking. You'll see I'm going to present some of my personal background in this general area, some of which Diego had alluded to, and it's going to help contextualize how I think and what I'm going to say in my comments. I'm also going to try to bring in some historical context. I think, as many of you are working on historical demography projects, I think it's incredibly important to look back before you look forward. And I think this applies more generally to spatial thinking in social sciences generally, but also specifically within demography. Some of these things I'm going to imply rather than make explicit, but I hope you make some of those connections. I'm also very conscious of the fact that I'm also here to learn a lot more from, I've been trained in the United Kingdom and the United States. It's a very narrow perspective sometimes, and certainly a very narrow literature that you tend to focus on when you're in that environment. And there's another world out there that we need to pay more attention to. So any comments or feedback or suggestions on anything I might say, I'm very grateful for. So I decided to start with just 2 slides that, so I lead a demography training program, and I've been leading a variety of training initiatives around spatial analysis within demography. And there's 2 slides I wanted to start with just because they were written, in this case, they was written and published in Science magazine about some frontiers for social science. This was from 2005. William Butts and Barbara Torrey, both well known within the demographic community. And in the list of 6 things they identified as trends, directions, whatever you want to call it, with respect to how we do our research, I just want to point out that GIS tools was one of this 6 list. You'll be pleased to see longitudinal data, you'll be pleased to see statistical methods in there, but this is a thoughtful piece about things we ought to be doing. In that same article, they had this nice life machine where you enter through one door that says birth and you leave through another door that says death. So I actually thought that was quite appropriate for demographers to think about. This is the second similar kind of comment. So Rebecca Clark is the branch chief of the Population Dynamics Bureau at NICHD. So I'm at a population center that's funded through this particular division. And she was asked in an interview about training, about students and training, about the future career in population, what they should take and what they should be focusing on. And so the answers included this list of 4 things: a lot of math and statistics, a grounding in biology and genetics. We're increasingly seeing more interest in gene environment kind of research, learn spatial methods, and read scientific research outside your field. So these resonate with me as part of a training directorship program, but obviously in both of these 2 cases, they've referred to either GIS, which to me is a very narrow thing, and then spatial methods, which is a broader set of perspectives. It could be conceptual, it could be data, it could be methods. So just to contextualize some of my work and my feelings so you understand, as a demographer, it's important that we reflect on things like residential histories. So I've lived in 5 metropolitan areas is a loose word when I'm describing State College, but the others are large kind of metro places. The first 3 were in the United Kingdom. So in Hull, I was trained, I was very interested in high school in geography. It was my premier kind of field. I did an A-level in geography, the usual thing in Britain, and geography had a high visible status within that rank of education. I was very fortunate to go to Bristol, which I still regard as one of the leading geography programs in the United Kingdom, if not the world, and then also fortunate to be at Cardiff. Cardiff was an exciting time. We became a national research centre for GIS at the Wales, it was in the town planning department in Wales, and it was led by people like Paul Longley, Michael Batty especially. So Michael now at UCL and things like that. So exciting time to be trained and to be exposed to spatial thinking, GIS methods and how they could be used across different disciplines. Then my academic career post my PhD has been in the United States. So I spent 5 years in Los Angeles, and then I moved to Penn State, which is where State College is. I want to point out that I've been a Liverpool fan, irrespective of where I've lived across not 50 years of life, but certainly teenage years to the present day. So either I'll be very happy next week, or you will be very happy next week. But this is important because I'm increasingly interested in the work I do today about exposure to place, and exposure to place and how it informs behaviors and health. And if you're interested in child development and child psychology, you'd be very much interested in where that child grows up as a very young person and what sort of modes, what sort of kind of family background and almost moralistic kind of things are passed down generations. So early childhood is key. And so the exposure you might be interested in is then. A lot of our research, frankly, focuses on the present day. And so there's issues I'm going to talk about as I go through the talk that relate to some of these themes. I might skip over this, I'll go quickly through this. I've been a founding director of the GIS unit within the Pop Center for about 15, 16 years at Penn State. And so my job there was to help facilitate faculty research, to help leverage their research to make it perhaps hopefully better. I mean, I certainly hope that was the end product. Not to get in the way of their research, but to provide a service. Usually it was constructing data sets for them to use, not necessarily doing spatial analysis. I will talk about that later. I've also been involved in training in lots of different ways and also in trying to promote spatial thinking across different fields. So I've referred here to some of the screenshots at the bottom as a special issue, just focus on childhood obesity and how GIS and spatial thinking can be used to inform our understanding of childhood obesity. The demographic research special issue was actually a product of the training grant, where all of the papers are led by graduate students and postdocs who attended that workshop. Both of these 2 special issues, and in fact the one in mathematical population studies is currently in progress, all of these things have a diversity of people from different disciplines, Many of them have multiple authors on the papers. Many of them are using either very creative data sets or they're using different spatial methods. So the heterogeneity, if you like, of the field of spatial demography is very broad, at least when I look at it. The lens I look at it, I think, is very, very broad indeed. But there are challenges in a lot of this, and some of it's going to be related to training. So in my own work, just to continue a theme of the heterogeneity, I've tried to do work that I think, the work I've done collectively, this is just a sample of some of those projects, is often focused on a health or a demographic outcome, and is focused on a very particular scale of analysis. And sometimes that scale of analysis is matched by a temporal scale of analysis. So I've done a lot of work, not represented actually on these examples, but in urban kind of segregation research. The example I've got here is actually from Tehran. I'm collaborating with a young investigator, Hamid Destradi, who's in Iran. And this is just a study of accessibility. It's a very straightforward GIS study of accessibility to different types of services within the city, the metropolitan area. In other work I've been doing, moving across the diagram towards the more recent work, is looking at things like how we can understand malaria along a border, an international border, and we're looking at the Karen population on the Thai-Myanmar border. This is with an anthropologist called Daniel Parker, who's now at Irvine. And in the far side of the screen, I've been doing work on activity-based research for quite a number of years now with Shannon Zenk at the University of Illinois in Chicago. And this is basically, imagine it to be data collected on somebody's location every 30 seconds across 30 consecutive days, right? So every 30 seconds. So the temporal resolution of the data has varied across the projects I've been looking at. In expanding the spatial dimension, we've gone from the local, if you like, or the urban to some regional studies. So I've done regional work on health accessibility, particularly trying to understand cancer, and cancer in the region of Appalachia. Appalachia is a relatively poor area of the United States, and so there's been issues about not just the mortality rates, which are the end result we see, but also about how we can improve screening rates. And so part of this has been assembling and linking contextual data at the county to individual level medical records and individual information. The other studies, the study I put on the slide here is a study of legacy of slavery, which is going back in time. So this is a project that's going back to the 1860s, and is basically the map you see is a reproduction of a map of slavery, the concentration of slavery when Abraham Lincoln was president of the United States. And what this project is looking at is the legacy effects of slavery on things like heart disease and deaths related to heart disease. And what we see in this particular project is those places where slavery was the highest, the pace of decline in heart disease is slower than in other parts, when slavery, compared to areas where slavery wasn't as intense in the late 19th century. I just put another map up there just because some of these methods have used spatial econometric approaches, some of them in multi-level modeling, some of them have been small area estimation kind of projects, and this one here is just a geographically weighted regression application. I'm not going to talk very much about my research, but this is just the array, to me, of what's possible is huge. So Daniel Parker was a graduate student at Penn State. He's the one I worked with on his project, really, on the Thai-Myanmar border. And we put together a review of spatial demography, and this was done in 2013. I think it's legitimate every so often to go back and ask what's happened. Were we right? Not that we made any projections particularly. But what would it look like another 5 years from now? If I was writing a training grant now, I have to be able to convey to reviewers not just where we are, but where we want to be. And so that's the kind of hat I think about when I write research grants or write training grants, which is part of my life. So I want to go through some of these things. What did I write? Well, I know there's a lot of text on this slide, and I apologize. One of the things is that many demographers would like to receive training in fundamental concepts. Geographic data, geospatial analysis is limited, patchwork, or non-existent. I don't know how true that is in Spain. I know it's not true of many people in this audience in the room. I realize there's others following online. But when I look at the field, especially when I look at through the lens of the US model, I don't see very much explicit training in spatial analysis by and for demographers. And I'm saying that being at a leading population center who teaches a course in spatial analysis for demographers. I think this is problematic for the field because, as the highlighted text below, we are going to encounter a whole variety of different types of data, the volume of data we deal with, and I realize, again, some of you in the historical projects are dealing with massive amounts of information, but the sources and the forms of data are just expanding. And how we do field work, how we conceptualize problems, the sorts of information we're leveraging. This is a Fitbit, which has got all kinds of data. This particular one isn't geospatial, but there are products out there that can link everything about my heart rate every second to a location. So we're changing the data that's possibly available to us, and we've got to be creative. So we're not training people in methods we know, we're not training people in spatial concepts, and we face an environment where the data are changing very fast. So one of the problems you face, so I run a demography training program where we have approximately 40 faculty, about 40 different graduate courses on the books, about 10 of which are taught every semester. We have 65 graduate students, and those students have to get through the degree program, and they have to take 8 courses to get through that degree program. We have one course allocated to spatial demography, and so you have the situation where spatial demography wasn't something that was being promoted by, let's say, an older generation of faculty before I got there, and so I came along wanting to add a methods class. And it's nice for the students. They often treat graduate school as an opportunity to learn new methods, but they're also exposed to event history analysis, to social network analysis, to multi-level modeling, and they don't want to stack up too many methods courses. They actually do want courses in mortality, migration, fertility, and then other more general kind of population science courses on segregation, for example, or immigration policy. So that's a problem. And then you also have the situation where, in the American model where I am, I've got 15 weeks to teach spatial demography. Just like this talk on my abstract, you can't do it in 15 weeks. It's just too broad a field. And so that's problematic. And at the same time, if you someone like me who tries to pay attention to this field and the literature, you see people being incredibly creative about data and about methods. So the field is being pushed further and further forward at seemingly at a faster pace, and we can't get teaching into the classroom, training into the classroom. I say that, I work with GPS data, but there's no class that I'm aware of at my institution, and my institution's a very large North American university. There's no course I'm aware of that is about the collection, the handling, and the analysis of GPS collected data. There are researchers who do it. There are postdocs who learn how to work with the data, but there's no course that's disseminating it to a larger audience. So these challenges are in stark contrast to some of the things that we know to be existing right now. Rapid interest in spatial perspectives in general, a lot of interest in combining research with policy. I think we're going to see an applied demography field being rejuvenated because of perhaps the political environment we work in or whatever it might be. But policy is an increasingly important dimension of many of our social problems that we face, whether it's obesity, whether it's health disparities, whether it's poverty, and whether it's in the United States, Europe, or elsewhere in the globe. So I think demographers are going to be perhaps more frequently visible at the policy table. That might happen. I hope it does. We also see a dramatic rise of interest in the last decade. It started earlier than that, but in the last decade, especially in the integration of data on individuals with data on places, so a contextual kind of linkage. So traditional multi-level modeling. And as I mentioned before, there's going to be changes in how we even think about our problems and therefore how we design our field work. So we're going to have to be quite adaptive. So a few years ago, I wrote a paper that was more broadly for a health audience. It was part of a special conference on social inequality. And in this presentation, and this paper with T.C. Yang, who's at Albany, we talked about 5 different areas of the field. Conceptual development, new types of places, the study of movement, and then paying attention to the fact that places change, so context change, so the dynamics of context. Training, to me, transcends the other 4, but training was just put down. Here's the 5th issue here. And you're going to understand, hopefully, why I say training transcends these as we go through the rest of the talk. I want to point out, before I go any further, that while I wrote a paper or guest edited a series of papers in demographic research on spatial demography, there are at least 2 other very well-known collections of reviews and applications or discussions of how spatial demography can be informed. And so the PNAS, published in about 2005, Ken Wachter was the editor of that. And then Population Research and Policy Review was edited by Paul Voss, and this was published in 2006-07. So they're more than a decade old now, but I think it's safe to say that the papers in these journals I use a lot in my teaching. I use them as exemplary readings that people should look at. I think they're outstanding papers. I also want to point out that James Raymer and colleagues wrote a paper that was presented at the PAA in Denver about 3 weeks ago now. And so this is a paper I wasn't even aware. I missed the talk, which is embarrassing for me to say. But this is a talk that I believe is now accepted in Population, Space and Place, or it's going to be forthcoming in that. I think it's that journal. And this is a slightly different kind of perspective on the field. And in fact, it resonates with one of the themes I want to talk about, which is the history of ideas and the fundamental concepts demographers use, where they came from and how they've been adapted and used. And this is a paper talking about, in many ways, going back to multi-regional demography and other frameworks for studying spatial issues within demography. So I'd encourage you, if you're interested, to look at any of these because they're worth your reading. James's paper is actually online at the Population Meetings website, so you can download that paper. So, big question for someone like me is, where is spatial analysis in demography? For those of you that may not know the field particularly well, several of the books on the nearest to me are classic textbooks in methods and materials in demography. And you'd be hard-pressed. There are chapters on maybe administrative data, census geographies, but there's nothing specifically about methods. It's about the boundaries, the levels of analysis we might use. So you won't find spatial demography as a topical area in many of the traditional demography textbooks. In the area of population and population geography, you also don't see it very much. You certainly don't see very much discussion of advanced spatial methods being used and applied in geography. So Population by John Weeks is an interesting book to follow because there's been many, many issues and editions of this book. And what you do see, John Weeks is one of the leading players in the field of spatial analysis in demography. And what you see across his textbook is an increasing use of, well, there's always been maps and always been very good spatial description, but there's now discussions of new technologies like GPS linked to the fact that the demographic and health surveys now are geocoded and how leveraging the geocoding data of the DHS is important. So you can track the kind of growth of interest, if you like, within just looking at these different editions. The other textbooks, certainly the ones on the far side, these are actually textbooks that are explicitly spatial. So the Multi-Regional Demography by Andre Rogers is a classic book in the field. It's one that Raymer is referring to. And the book by David Plain and Rogerson is actually a really good applied demography kind of textbook, very good on introducing different fundamental measures that we use across the discipline. And so that represents the other extreme. So you've got a couple of books that are very explicitly spatial, and you've got this, there's a gradient of spatial as we go across this. The ones in the middle, one's a United Nations publication series. It's quite dated now, 20 or so years ago. The only chapter in the methods version, the methods section here, is on small area population, and there's a chapter on multi-regional demography. In the syllabi collection, in America, the American Statistical Association collects syllabi before we did it online. And you can look at this, and there's a couple of very basic courses, but none of them were called spatial demography. So from this background, we've emerged and done quite well. I don't know who knows Waldo Tobler in this room. Waldo Tobler sadly died earlier this year. He's very well known for the first law of geography. At a very basic level, the first law of geography basically implies that if you know the attribute of a particular place, it's very likely that the attribute of surrounding places is very similar. So there's a high degree of spatial dependency between places. And so this is the first law of geography. So I want to clarify that virtually everything I'm going to say in relation to this is my own opinion, and only those I've worked very, very close with are even going to be somehow appearing in this conversation. And my more distant friends and my colleagues I don't know have no bearing on what I'm going to say today. It's a bit crude, but I wanted to acknowledge Waldo because he's been an important influence both in geography and I think in how demographers will nearly always cite this paper. I don't know how many of them have read it, but they always cite it when they're referring to spatial dependence, or nearly always seem to cite it. So I've talked for quite a while, and I haven't even defined spatial demography. So this is a very general definition, is a spatially explicit study of population and population processes. And this is a definition that comes from the paper with Dan Parker. My colleague and friend, T.C. Yang, has a slightly different version, the scientific study of how space is related to causes and consequences of population processes. I think to all three of us, we all work together, I think what we all think of is how different spatial concepts, spatial data, measures that are derived or explicitly informed by spatial thinking, and then spatial analytical tools all fall within the realm of spatial demography. I've implied here that spatial demography is as big as the course catalogue, and I'll try and show why. And I see this as being both a strength and a weakness. It's a strength because I think spatial has permeated many different areas of demography. So that's truly very good. My evidence for this is I used to organize conferences before the PAA about spatial demography, and it's not that they don't exist anymore, but and also the PAA has 3 or 4 sessions usually on spatial demography labeled that way, and they fall under the data and methods sections. But today, if you went to the conference in Denver, you would find 40, 50, 60 sessions that had a paper where a spatial concept or a measure or even a method was actually used, and it wasn't found in the spatial demography sessions. So we don't have to see a paper that says something like a study of fertility in X, a spatial analysis, because it can just be a study of fertility in X, and if you read the paper, you know that spatial analysis was part of the process behind that. But I do also think it's a weakness, because one of the things that is also happening is I don't think we also have an identity yet, which is quite odd for somebody who's in it and knows lots of people in the area to even probably say things like that. So why I think spatial demography is across the curricula and bigger than just a label with one course is because in research, it's not just the map we're interested in. Many often, and sometimes it could be for privacy reasons, we're actually interested in deriving a measure that masks other things. So we might be interested in the distance between a home and a church, or a home and a clinic, or a home and a school. We need to know both of those locations on the team, but analytically we don't need those locations. We need the measure of distance, maybe a street network distance. So we're using data, spatial data, to drive lots of variables, to build contextual databases, to integrate data on the same levels of geography, and we're using it also to refine particular analytical approaches. We're extending the analytical toolkit and bringing in explicit spatial modeling. What this, I think, entails is that a demographer who's serious about understanding what the role of spatial analysis may well be in their project is they have to begin to gain a knowledge base and draw upon theories of place, new data, new methods, the use of current technology, and the use of emerging technologies. So I'm going to have to speed up a little bit, but I want to talk about, deliberately I put in a few key points I wanted to say about space and how we think about space, different geographical areas. So in my experience, there are many blinders on how we theorize and therefore how we measure place. And I hope you'll see that in a minute. There are different disciplines measure place differently. So obesity is an epidemic in the United States. It is in many countries. And if you work with nutritionists, often you're calculating and defining the context where a person lives using a distance buffer around the person's location. Right? That's what a nutritionist would do. That's what a health researcher would do. If you're a sociologist or a demographer or a geographer, we use a census tract. So we have something that's given to us by an administrative unit, and that's our definition of context. So we're studying the same problem. We could, in theory, be studying the same databases, but we conceptualize place in a very different way. It's key to a lot of things I do, a lot of things that you do, I hope, that measurement in general is not benign, but measurement of place is certainly not benign, meaning that how you define place can influence the results. And this is a quote just from a classic statistics book: your results depend upon your units. Right? It's true in 1950 and it's true today. How we do our work and how we think and conceptualize what place or what neighborhood or whatever unit we want, whatever definition we want to think about, will vary our results. So in the multiple choice questionnaire, question 17, what's the best unit to measure place or context or environment? Well, it clearly depends on your research question, but I would suggest to you that it's not always a very easy answer, this particular question. There are places, but this is a place in Holland and Belgium where you can actually see boundaries written on the ground. But there aren't very many places like this, right? So you can be in a cafe in the Netherlands and your waiter could be serving you in Belgium. This is an artifact of the particular history of this particular place and little enclaves within the database. But there's nothing like that. But we impose these boundaries in our models. We can't see any lines on the ground, but that's the challenge. A fourth point, how we measure place is important, but also how we measure time and how we think about time. Again, some of you in the room, I don't need to talk about this. But often, place is paused. This is a phrase used by Yifu Tuan, a geographer, and others have referred to a lot of the work we do even in multi-level modeling. When we link the individual to a place, we may have historical data on the individual, like a residential history, but we don't, well, that's a bad example, but we don't know enough about actually it's true, we don't know enough about the location back in time. Again, I know this isn't true of some of you in the room, but that's not the typical perspective. A lot of us have cross-sectional data on place, linked to longitudinal data on people, if we're lucky. And clearly, historical processes evolve over time, can have an impact on what we're studying today. So we need to know the past to understand the circumstance of growth, decline, or stability, whatever it might be, across time. Time is also important because its places are dynamic. This is the example of the Real Madrid Stadium. It's empty most of the time. The tourists go there, and I was lucky to go there myself the other day. But sometimes it's a cauldron of 70 or 80,000 people. That's a very different place. The other stadium is the Waka Stadium the Wada Stadium for the Atletico Madrid, and this just proves the problems with having data that's wrong. This is an old photograph taken from Google Earth, but it looks like it's still being redeveloped. But more generally, I'm interested in time increasingly with health researchers at a micro scale. So I'm interested in events that occur more frequently than perhaps say an annual sequence. So I'm interested in daily and weekly events. I'm interested in where people shop, who they're with, where they shop. I'm interested in how they exercise, where they exercise. So we can't measure this as a propensity to exercise over a month. We want to do it on the day or even the hour they're exercising. So we're collecting really fine temporal data. Another point, places are more complicated than people think. Or there's a lot more to places than people think, which was what Shrek said to Donkey in the movie Shrek. And this is about, the analogy was about the onion, and the onion having lots of layers. So you peel back one layer, and you've got another layer below it. You peel that again, you've got another layer of the onion. So geographically, we may be, the person is at the center of the onion, and the nation is the highest level. You peel that back, you get a county or a district. You peel that back, you get smaller units. So we are embedded in lots of different geographies simultaneously. That's the main point I'm trying to make. But also it's about the complexity of space. The example in this diagram is Atlanta. It's not very clear, but Atlanta has multiple geographies to it. And if you're interested in school districts and education outcomes, you might choose a very different level of geography for the processes that you're looking at and the outcome you're looking at than another level of geography. But some would not necessarily, for whatever reason, might not do that. So places can be very complex, and they're embedded as well. So training, Ken Jennings wrote a book. He won a television show called Jeopardy! It's a general knowledge TV show. He won lots of dollars. He wrote a textbook called Maphead, which is basically a book written for people like me who love geography and love maps. And he made the observation that the US is the only country in the developed world where a student can go from preschool, so 4 or 5 years of age, to graduate school without taking or opening a geography textbook. Right? That's a slight problem. In my introduction to the special issue on obesity research, I wondered whether this had a role in limiting the ability to think spatially, to understand the world around us, to think about spatial relations and the interactions between places, spatial structures and spatial processes, and to take place seriously in health research. And you'll see why I say that in a few minutes. I'll skip this, but if you want to know about my course, I'll come back to it. But the main point of this slide is that I focus, half of my course is on what I think of as fundamental spatial concepts and the challenges of using spatial data. What the student wants is everything after week 8. They want to learn, how do I apply these complex methods? What I don't teach in my class is spatial panel data analysis, agent-based modeling, Bayesian statistics, and as I mentioned before, I don't talk about geotag Twitter or GPS. Right? So you can't cram everything into 15 weeks. And I choose deliberately to focus on concepts, probably much to the chagrin of many people, until I think you need to know what you're doing and how you should think about your data before you start using a GIS or a particular software package to analyze that data. So that's my emphasis. So this was an American Public Health Association conference in 2014, national conference. This was their buzzword that described their conference, called healthography. I don't know how much traction this word has anymore. It doesn't deserve any. And the reason I say that is because if you know Greek, you know that ography means the study of. I think the people who thought of healthography thought somehow it was connected to the geography bit, right, the jog bit, but it wasn't. So healthography just means the study of health. The subtitle of their conference is on how where you live affects health and well-being. So that isn't, I mean, maybe the subtitle, but that isn't reflective at all in the labeling of the conference. My point here is public health is another area, like demography, that has also discovered spatial analysis and geospatial data, and are now trying to, not that some of them didn't know of this, but it's expanded, it's like a tidal wave. Other analogies have been made to multi-level modeling. But the discovery of space and discovery of contextual analysis has just mushroomed in many fields, and this is true of public health. If we step back and we look at more fundamental concepts in spatial reasoning, you would be looking at and better understanding place by focusing on these words, and I'm not be able to go through all of them, but location, distance, networks, so understanding connections, particularly in relation to spatial dependence, which is also on here, scale of analysis. These are fundamental concepts that people don't get training in, right? If you know GIS and you've used GIS yourself, you'll think, how can that possibly be true? But in the context I'm in, you could ask people for definition of these words in graduate school and you might not get a good answer. Why this is important is because if you realize and have used geospatial data, you know very well that depending on whether your data are points, networks, areas, or surfaces, it's going to dictate the sorts of analysis you're going to do. So you've got to understand fundamental concepts of how data are collected, analyzed, and stored before you get to the process of modeling and manipulating and then modeling the data, or even combining these things across different types of geospatial data. And again, people want a course from me on spatial regression starting in week 1, and there's no prerequisite for having done a GIS class for my course. And so how do you get from building a data set to suddenly doing a spatial regression model in 0 time? You really need to understand geospatial data, and that's a challenge. So again, looking back, this is a book written in 1961 by Duncan, Corser, and Duncan, very famous sociologists in the United States. They wrote a book called Statistical Geography. They were sociologists. Statistical Geography. The subtitle, Problems in Analyzing Aerial Data. So we've known, since 1961 at a minimum, there are problems in analyzing spatial data. And they say we've accumulated a collection of methodological conundrums. And what they're explicitly talking about are things like scale, the modifiable area unit problem, how your results will change if you change scales of analysis, and a whole other series of issues associated with area data. So we know about this. We don't necessarily, we seem to have forgotten about this. We don't teach this as much as we'd like to think we do. The data are from Chicago, so this idea of an onion. This is just 2 variables. They're very straightforward variables, land area and population density. Imagine a person lives in the census tract, and one particular census tract, and if that was the context we were interested in, We know what the land area is, and we know what the population density is. It's very high in this case. Now, not surprisingly, we go to a different geographical level. We move up the hierarchy. The area increases, and the population density in this case goes down because we have more heterogeneity in population density within the community area compared to the census tracts. But the person living in that point at the center of the census tract lives at a population density supposedly of 91,000 people per square mile. But if your unit of analysis was higher, it drops in half, and then as it goes up, it drops again and again and again. So how you define place, in this case, is quite fundamental to a very straightforward variable demographers might use. I'll skip this slide. So one of the things I ask my students to do, if they're interested in area-based geography, area-based spatial demography, is I ask them to map the dependent variable. This is the variable you're interested in. This is the variable you're trying to explain. Why don't you map it? You know, in the US context at the state level, only Florida and Georgia are actually alphabetically and geographically adjacent to one another. So you can't look at a table and then infer results. You've got to look at a map to look at the embedded spatial relations. In one of the readings I give out in the class is an article by Paul Voss, and it's actually a reworking of a paper by Sam Friedman and Dan Lichter looking at childhood poverty. And one of the things that Paul mentions in the paper is if from the map of the dependent variable, they essentially know the spatial order correlation. They therefore essentially know that it's very likely some kind of spatial model needs to be used to analyze and interpret the results of the paper. And in the original paper, that wasn't done. Another paper I like, actually, is by a student of Paul Voss's, Kathy Brazier, who's now at Penn State. This should say rural sociology. It does say rural sociology, it's just across the page. But what Kathy did, and what I encourage my students to do, again, with any kind of geospatial data, especially area data, is to calculate something like a Moran's eye. So here is a list, here's the descriptive statistics table that you see in every journal article, and all I'm asking the student to do is, instead of reporting just the mean and the standard deviation and other attributes, report something about the spatial autocorrelation within that variable itself. And so the Moran's eye is here. So the Moran's eye in this case is significant for all of the variables, and Kathy writes that univariate statistics and visual assessments indicates significant spatial effects, and therefore the likelihood of running spatially informed kind of models. These are insights that are fairly fundamentally obvious from very simple things. You don't have to know that you might face a challenge analytically with your data if you've done this. So they're two very simple things. So I'm very interested in scale. These are my two kids, and they're on two different chairs. And the problem that we face is what we call the Goldilocks problem. Goldilocks is the story of the little girl who goes into the house. Well, in my version, it's different in other cultures, I'm sure. You go into the house and you want to find, they try the food and a bed, and they try the father bear's bed, and then the mother bear's bed, and then it's the child's bed they like. It's the one that's just right. In any case, the point here is that if you're interested in a problem, you have to understand the scale of analysis the problem is being measured at, and you have to understand the scale of analysis the problem actually operates at in the real world. And oftentimes there can be a mismatch. What we do as demographers, what we do in many fields, is we impose a unit of analysis or a geography on the problem and then run with it. Oftentimes not checking to see whether or not if we change our analysis, the results will be stable or not, or whether we can be creative about thinking about geography. So this is a really important challenge and problem. I say that because demography, if there's one field I've been affiliated with, it's demography is measurement is vital to how we do our work. And so when we think about designing event history analysis and panel studies, it's important that the temporal frequency of the unit of time matches the process of the phenomena we're interested in. And so if we're interested in things like marriage or fertility transitions, we might let's say we want annual data, and annual data would be in fine enough resolution. If we're interested in labor market outcomes, we might want monthly or maybe weekly data, right? So the temporal resolution we pay a lot of attention to. I've got other things here about definitions, but my point is quite simple, that we need to pay attention to spatial units of analysis. And we don't. We tend to use what's given rather than think about the world in a more realistic way. So I put this little diagram up. It's just my view of how we study space in a lot of different fields that use multi-level models, where we're often constructing data. In my unit, we used to construct data sets, linking individuals to contexts. And this is how we think of spatial context, just these individual units, and they are isolated from each other. There's no particular meaning. If we regroup them, it becomes central Paris, right? So this is like a jigsaw puzzle. So every person is in a particular puzzle piece, but we don't know anything about other puzzle pieces. If you know the geography, you understand where the connections between people and the places are in your data set, and you also understand the embeddedness of a particular puzzle piece in its surrounding puzzle pieces. This is what we know about the world, but this is what we sometimes forget and don't leverage enough, although we're beginning to see it. I encourage you to read this article if you're interested in a critique of multi-level models. This is a kind of meta-analysis of neighborhood and health effects in the United States. They have about 259 different studies. I hope it's relatively straightforward and visible enough to see. But this Arkea et al. Paper is fascinating reading to someone like me. I'd not read it until about a year ago, so it was after it had come out. But this table tells everything. So number one is referring to, if you look at the distribution, you see that most of the analysis is describing a neighborhood in the context of United States research on neighborhood and health as a census tract or a census block. So the comment is, it seems unlikely that for 3/4 of interesting questions in the field, all of the relevant processes and all of the outcomes we're looking at, I should add, are occurring at the scale of the census tract. Right? So why 75% just seems an unnaturally large number. Number two, to compound the problem, 95% of our papers only use 2 levels. And what here they mean, individual is level 1, a geographical area, usually the census tract, is level 2. And that's number 2. Number 3 hits home to the geographer in me, in that the vast majority of papers, so 96% of papers, don't look at whether or not different neighborhood units and how you define neighborhoods might change the results. So this is the modifiable area unit problem. And other associated literatures, so the uncertain geographic context problem. So there's a lot of work done in neighborhood and health research using explicitly neighborhood data that isn't really spatial. It's not spatial in the sense that it's leveraging different levels of analysis. It's not looking at spatial multi-membership models, although that's an emerging area. So there's a lot of naivete about how space is actually incorporated and used. There's a paper by Tom Glass and Matthew McAtee. It's quite old now, still a very good paper. This is a paper about obesity. One of it's about obesity. And in the context of the paper and how I think, I see a list of factors that may be related to obesity, are listed, and they're grouped by different kind of thematic domains. I put in the yellow box the fact that how do we think about and store the data as if it's a GIS? And all I want to focus on is the fact that there's variability. All of these things might be relevant to childhood obesity outcome or an adult outcome. All of these things can be measured in different ways, and some of them are measured in very different ways from each other. Some of them vary by geographical scale, and some of them can be represented as a whole series of different geographical features. So I'm just going to focus on residential segregation, because it's an area I do work in, where residential segregation is often measured for census units, so census tracts. So I was involved in a study of racial segregation, looking at the spatial or geographic dimensions of scale. And we know this is a phenomena or a particular issue we study where it occurs simultaneously at many different scales, right? So I haven't got time to go through all of the details, but one of the things we did was we took studies of all the metro areas, large metro areas in the United States, and calculated what we might call a local level within 500 meters of where somebody lives, measure of segregation, and then repeated it at different geographical scales. In this example, we're reporting just the numbers for a local area, 500 meters around where you live, for Atlanta and Pittsburgh, and then again for 4,000 meters around where you live. And what we were interested in is the profile, or the segregation profile, the degree to which segregation declines across the different scale units. And what this emerges from this, and it emerges in the maps as well, is that Atlanta is a city that's dominated by macro-scale segregation, and Pittsburgh is dominated or has a micro-scale patterning to it. So the profiles are much steeper for Pittsburgh and they're very flat for Atlanta. What this means, in a very general sense, is you can have a census tract in Atlanta where it's just south of the downtown, it's predominantly African American, And you could travel 10, 15 miles or 20 kilometers or so, and it'd still be a census tract that's relatively high African American. So the larger spatial scale we look at, it's still very high levels of segregation. In Pittsburgh, after a very small distance, you're in areas that the segregation statistic for African Americans is considerably lower. And you can see the patterning on the maps just as a visual representation. This gets at all sorts of issues of how we think about space. And so what that was a subtle way of transitioning to other people's work who've looked at how we think about space as continuous, not as discrete spatial units. How we can calculate a variable for a location and calculate it again using different definitions in our case, different radial buffers. And so we can begin to think about deriving multi-scale measures. And people certainly have used gridded databases and started looking at creating multi-scale grid-type databases as well. So this is where one of the areas of innovation is. I know I'm running out of time here. So the view, to me, when I look at the literature about neighborhood and health effects, even demography and how we think about space, we have this focus on one geography. So I call that monadic, so the home location, the home census tract. There has been literature, and we've been interested for many years on the fact that we spend time elsewhere. And so there's a whole literature on spatial mismatch theory that dates back to 1968 that looks at the mismatch between where we live and where we work. And increasingly in research, we're seeing people being interested in where we shop, where we go to, where the areas we shop relative to where we live, where the school is that the kids go to, where the exercise areas are that we go to. So we're beginning to move to look at non-residential exposures. And so this is then a very different way of looking at space. In a more conventional spatial demography, some people listening to the talk might think, oh, spatial demography means incorporating spatial lags and dependence, and so that's clearly also possible. We start to look at not just the poverty rate where we live, but the poverty rate surrounding where we live. And then over time, to make it even more complicated, we have this dyadic, so we've gone from monadic to dyadic, or to polyadic, meaning we've gone from one representation of place to two, or to multiple simultaneously. So this is just purely a diagram that's trying to reflect residential histories. And if we are to truly understand a behavior of an individual at time 0, we need to understand where they were at time 1 and time 2, and have attributes measured on them that we've been interested in. And we can link that. As I've implied, I do a lot of work on activity space. So this is just changing the time to the current, to 1 day or 1 week, and looking at movement in a micro scale across different types of places. So again, if you're interested in exposure to air pollution, maybe you have somebody walking around with a monitor while a remote sensing device focusing on that, and see where people go, linking it to geotagged information. I'm just going to flick through a few slides here. So I've called this spatial polygamy, for want of a better phrase. And basically it means that we're loyal to more than one place, right? We're spatially polygamous. So these 5 places, I've lived in all 5 places. I have different loyalties to all of those 5 places. I even have loyalties to virtual places that I've never visited. I have an affinity now for Madrid. The places we're visited and exposed to, the people we're exposed to, they change many things about our behavior, and some are more important than others. So we need to understand this and unpack the spatial and the temporal. In the work I'm doing on activity space, when we're talking about exposure to different types of concepts, there's a whole series of levels, there's a whole series of different types of activities we engage in, and we want to know where these activities are, in what types of place. I should say that a lot of my work is standard area-based demography, spatial demography, and usually I'm using some of the units I've already criticized. Where in the sense that I'm looking at units of analysis that data are easily available, but I like to think that most of the units of analysis I'm using, we see a connection between people and places that's fairly explicit. So normally, if you're looking at places in the United States context or school districts, you know that there's a service being provided, and you know you're paying for it if you're a resident. So your local taxes are paying for a service. So there's a link between your actions and behaviors and the services that are provided. So they seem like fairly realistic entities to study. But also I'm increasingly interested in activity spaces, and in the context of that, that raises all kinds of other questions about exposure to place and how we measure it, and capturing rare events across a period of a 24-hour day. I put on this slide this crazy diagram about activity spaces in a cartoon, but the more important is the other part of the slide, which is talking about an activity space-like study done in Berlin in the 1930s. And so we think that activity space research is new, but there are people who have been doing this 80 years ago in a different form. Different types of data, same concepts, same kind of measures they're interested in, child exposure to different types of places, knowledge of places, use of parks and playgrounds, that kind of thing. So I'm well behind time, I apologize. But I will get to a point where I can stop. So the spatial perspectives, I think they're very important that we need to retain more information in surveys. There's been a challenge to collect residential history data in American data sets. We would like to need to see more information on timing, sequence, and duration. We need to collect more historical data, new measures, and measures we collect we need to validate. We need to think about flexible units and using time constant geographies, which is where gridded data sets come into things. I think we're going to see a move from discrete data sets to continuous models of space, and therefore this issue of multiscalar measures. And I think we're going to see changes in looking at not just one exposure to place, but looking at dyadic or polyadic, multiple exposures to place as well. I'll close with 3 or 4 more slides. In the field of demography, there's obviously a lot of outlets we can use, and I should have added journals like Applied Geography and others that will publish spatial demography papers. The journal I co-edit at the moment hasn't got very many explicitly spatial papers in it. It has some. There's a nice paper by Barbara Entwistle about the Nang Rong project. There's her presidential address. I'm a co-author on the Reardon et al. Paper about residential segregation. When I look back across the last few years, one of the key papers that I think is a nice exception, explicitly a spatial method, explicitly addressing a demographic outcome, is the paper by Vitali et al. That appeared in 2015. If you are in this field, the one thing you would like is a journal called Spatial Demography, and we actually have a journal called Spatial Demography. Unfortunately, for whatever reason, it's been a bit, I describe it here as fledgling and slow to gain traction, partly I think because it's not that well advertised, or it could be advertised better. And there's several other things that have been characteristics of this particular journal in its first 4 or 5 years. So a regular number of issues and papers that appear every year, relatively low submission rate, and just long-term that isn't sustainable. And so for someone like me in the field, I find this disappointing because I know the potential is huge. What we see, in fact, is that the way the journal is used by the user community is the downloaded articles are the ones that refer to code or they refer to book reviews. So the code articles, the data articles are the most downloaded. Which again I think reflects what people want to know about. They want to see open source R code and Python scripts or whatever it might be, and they see those reviews and they see examples and they see people how they've talked about applying them to demographic questions. It's also a journal that needs to be far more international in its coverage. At the moment it tends to be fairly US focused, although there are papers emerging in other places. So I'd like to see more global coverage in this journal, and in the field I think we will see it. I think there's lots of emergent topics I'm happy to answer questions on about new methods, and also specific substantive areas that I know that as a concerned social scientist incorporating demography, we ought to be interested in things like disasters and shocks, refugees, spatial inequality, aging trends and mortality changes, population environment. These are questions that are fundamentally very important, and I think the nature of the fact that a lot of the understanding of these problems is going to be driven by geospatial data is incredibly important. And then linking substance to spatial methods, perhaps in the area of historical demography. As you can see by my talk, I get more excited by discovering old things that people don't remember, or there's a phrase about academic amnesia, where we go through these life cycles of knowledge and we forget about some of the classics in our field. I've only given you a smattering of some of these. In my lecture course, I try to have one old classic paper assigned every week that people read. And they're literally talking about definitions of neighborhood written in the 1940s, or even earlier than that. And so I think there's a place for educating the next generation of spatial demographers about some of the classics in the field. And I think the paper by James and colleagues, James Raymer, is going to perhaps begin to do something like that. But there are others we could do. As I've implied, applied demography is fundamentally important. I don't see enough blogging or information about conferences and meetings, about data sets, coding and training. And these are things that are passionate to me and I think we need to see more of. So I think I'll end there, given the time. So thank you very much. Thanks for listening.